If you're a healthcare provider working with Medicare patients, you've probably run into prior authorization requirements, especially for high-cost medications like Lokelma. It's used to treat hyperkalemia, a potentially serious condition for people with chronic kidney disease or heart problems. With Medicare, prior authorization is required to confirm the necessity of Lokelma, making sure it's the right choice for the patient. So how do you get approval efficiently and avoid delays? It all starts with gathering the essentials. Get the Lokelma prescription ready along with diagnosis documentation and treatment history. Make sure you've got records showing a confirmed diagnosis of hyperkalemia, supported by lab results that show elevated potassium levels. Medicare also looks at previous treatments, so it helps to show why other methods didn't work or aren't suitable for the patient. And don't forget the ICD-10 code, 𝐒87.5 for hyperkalemia, which Medicare needs to identify the condition. With everything ready, submitting the request is the next step. If the Medicare Part D plan offers an online portal, that's the quickest route. You can track your request in real time too. For those plans that only accept fax or mail, make sure all forms are complete and double-check the details to avoid delays. And if your patient is on a Medicare Advantage plan with Part D coverage, just confirm any specific submission rules as they can vary. For approval, Medicare needs comprehensive documentation. This includes a statement of medical necessity, where you explain why Lokelma is the best choice, along with lab results and other relevant medical records. Adding extra notes about why Lokelma is preferred over other treatments can help strengthen your case. After submitting, you'll likely hear back within a week for non-urgent cases. But for urgent cases, Medicare can process it in around 72 hours. During this time, it's good to keep an eye on the request status and follow up if needed. If the request is approved, you can go ahead with the Lokelma prescription. Just make sure the pharmacy knows about the Medicare coverage and confirm the patient's copay. But if Medicare denies the request, you can appeal. Look over the denial letter carefully to see what's missing, provide any additional information needed, and submit it again to make your case clear. Remember, Lokelma's ICD-10 code for hyperkalemia is 𝐒87.5, and some cases may also need additional CPT codes for testing related to the diagnosis, ensuring Medicare fully understands the need for Lokelma. Why does Medicare ask for prior authorization? Mainly because of Lokelma's high cost and specific use. Medicare wants to confirm it's medically necessary, given its critical role in managing hyperkalemia. And if the authorization is denied, simply appeal. With clear documentation and any additional information Medicare asks for, you can still make your case for Lokelma. Need it urgently? You can request an expedited review, usually processed within 72 hours. Is Lokelma only covered under Medicare Part D? Yes, generally it's covered under Part D or Medicare Advantage plans with Part D coverage, depending on each specific plan. Navigating prior authorization for Lokelma may seem complex, but with a well-prepared submission and timely follow-up, it can be straightforward. Good preparation can mean the difference between a smooth approval and a frustrating denial. And if all this seems overwhelming, remember you don't have to go it alone. Staffingly, 𝐏𝐿 offers support with prior authorizations, insurance verification, and more. By outsourcing these tasks, you can keep your focus on patient care and potentially save up to 70% on staffing costs. For more information, visit Staffingly's website.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.